It's your first time in an ambulance?
Sure. Sir, what's going on? Why am I being taken?
We're taking you to the hospital, buddy.
What? Why? I'm fine.
Have you seen a mirror?
Do I need to see a mirror? I see one every morning. It's fine.
I think you need to see one now.
Excuse me, sir. Sir, the trajectory of my life currently requires me to be at work. So if we could just get me there, that would be great. This is no serious matter. Sir, I fall all the time. I'm not what my wife calls, the most, I don't know, stately of person. I'm rather clumsy.
No, yeah, you need to go to the hospital for this thing.
No, it's not a big deal. There's like no, sir, do I have blood?
You do. That's why we're taking you to the hospital.
Tastes like ketchup.
That's another reason you need to go to the hospital.
That's a slime?
Yeah. You've been eating too many fries with ketchup.
Fries. I don't remember that.
Alright, we're at the hospital, buddy.
What? Why are we at the hospital?
Hey Doc, here's the 24-year-old male that we're calling you about. He has a penetrating injury through the skull down through the mandible. He's conscious and O4, fully responsive, and no complaints of pain. His last blood pressure was 127/83, heart rate of 82. Anything else?
No, thank you. Okay.
Alright buddy, let's get you into the hospital.
Wait.
Hello, Doc. I know we need your urgent help on this case to help remove the iron rod very carefully and to help prevent any rapid blood loss.
Okay, we first need to begin by irrigating the area. Second, we need to remove this rod as soon as possible. So what we're going to do first is we're going to remove the bottom proportion of the rod, then pull via the top. We need to immediately stitch and gaze the area, and we'll be doing this simultaneously to prevent excessive blood loss. Let's have the OR team ready in 2 minutes. This operation can only be done within a 15 to 20 minute time frame. So let's get going.
Is finished. The bleeding is stopped. The patient is sedated. And I'm applying the bandages now.
Hi, Mr. Gage. How are you doing today?
How do I look like I'm healing?
You look wonderful to me.
Mm-hmm.
So where's Mrs. Gage? Would you like her to come here to run the...
That woman? Fine. Come on! Hurry up!
It's a pleasure to finally meet you, Mrs. Gage. How are you?
She's fine.
Okay. Well, I wanted to go over some of the x-rays and kind of the results that we found. And so I want to talk about specifically the areas that were damaged when that rod went through your brain.
Look, so it went through my brain. I needed a little iron in my diet. Who cares?
Okay, well, we should care because the problem is it hit your prefrontal cortex, which could alter your ability to make some judgments. Now, I probably want to ask Mrs. Gage a couple of questions. So, can I ask, did you notice any behavioral changes in the last year?
He's so rude now and doesn't listen to what I'm saying and
Okay.
laughs at me and lashes out at people all the time.
So you
She would act normal. Maybe I would.
So would you call his decision's a little bit irrational?
Completely.
Okay. How about his memory? Has it changed since
Like
the
she's-
accident?
He doesn't listen, he doesn't remember much, like short term, if I tell him to polish his boots, forgets.
I'll be honest, it's the honey-do list. I've just had enough of it.
Okay.
Yeah.
Okay, well, all these findings kind of link to what I expected to occur. So I know all of this is going to sound like a lot and probably not familiar with a couple of terms I'm saying, but essentially this part of the area was damaged severely, so the frontal cortex. But there's particular areas, specific areas of the frontal cortex that can probably describe and explain why Gage is having some short-term memory. We have the dorsolateral prefrontal cortex, and
Do I care?
that's exactly where the specific area where the rod penetrated through. And then it ended up hitting here, the ventral lateral prefrontal cortex.
What does this woman know?
And so that is social cues. So if you notice Gage to go out in public and curse a lot, or don't have a filtered language, or just speaks bluntly and might be perceived as rude, it could be that there's severe damage to that area.
Nah, it's just my new crew. It's what we do.
And also the orbitofrontal cortex was also damaged, which is responsible for irrational decision making. So if you notice
What did I become,
that
a woman?
he doesn't make the best decisions, it could be damage to that particular area. But most importantly, the amygdala. I think the amygdala was severely damaged through the
The
accident.
heck is a amygdala?
Amygdala, yes, important. It's responsible for your aggression and mood.
Aggression.
Would you consider him to be a little bit more moody since the accident?
Oh, completely. I think he needs anger management.
I need anger management. Maybe you need housekeeping tips.
Okay, so what we're gonna do here, we're gonna go take some further testing and see that we could probably supplement a couple drugs to help with the hormone imbalance and probably the mood, just kind of like the mood imbalances. Till then, give us about 2 to 3 weeks, and hopefully we can come up with an alternative plan. Other than that, hope you treat her better.
Nah, this one's been a headache since this went on.
Okay then. Well, if there's any questions that you guys like to ask,
Will this ever change and go back to how it was?
I can't guarantee you, but rest assured I'll try my best.
Okay, thank you.
Nice to meet you. Take care now.
Come in, let's go.